Hi everybody, Angelique here from Proactive Pelvic Health Center. I'm here to just chat with you a little bit about tele-rehab for physiotherapy, or pelvic physiotherapy more specifically. First of all, what is tele-rehab? Tele-rehabilitation is a form of rehab that can be administered virtually online. So it's very similar to a video call or a FaceTime call, or speaking to somebody or meeting with somebody on Skype. So there's audio as well as video that allows a client and a therapist to communicate, to be able to assess and treat any concerns that a client may have. It's important to note that the tele-rehabilitation or virtual online platform that we use at Proactive Pelvic Health Center is compliant with all privacy standards in Canada. So not to worry, nothing is recorded. You're very safe in the comfort of your own home, so long as you're able to find a private space in your office or in your home to be able to take part in your tele-rehab session. When it comes to pelvic health, because there's a variety of conditions that we treat in all genders, it's really something that needs to be discussed with you and your particular therapist, but it also comes down to what your comfort level is, and if you do consent to all the terms to providing the care virtually. Now, of course, there are some limitations and there are some risks, such as being knocked off or the call being dropped off, not being able to have appropriate audio or video. There can definitely be some techie concerns that need to be ironed out. But otherwise, it is a very safe and private platform. Some of the conditions that we're having great success with are things such as urinary incontinence, urgency and frequency of urination, anything that is post-surgical, so this could be a post-C-section delivery, post-prostatectomy surgery, post-hysterectomy, or any other sort of gynecological surgeries, and other populations such as post-menopause and the pre and postnatal population. There's a load of information and education that we can give these people. Other conditions that we can assist with are conditions such as pelvic pain conditions, or pain with intercourse, or any sort of sexual dysfunction concern. So what does an assessment look like online once you are on the private platform with your therapist? The first thing we'll do with you is actually go through a full history taking. So we'll ask you lots of questions about your medical history. We will also ask you a lot of questions about your bladder function, your bowel function, and sexual functioning. And this gives us a lot of information, a lot of clues as to how we can assist you online. And no, don't worry, you don't have to drop your pants. There's nothing like that has to happen online. There's a lot of different external functional movements, screening tools that we can incorporate into your virtual session. So your therapist may lead you through a variety of different movements, assess your posture, assess your breathing mechanics, assess the strength and your functional strength through your core, your pelvic floor, and your lower body. All these muscles really have to work together, so it's really important to be able to screen for the function of these areas, and to see if there's any compensations that perhaps can be improved to allow for an improvement in the symptoms that you're feeling. So once you and your therapist finish an overall screening and assessment, then an individualized treatment plan will be put together for you based on your specific goals and what you're looking to achieve with your physiotherapy. Once your assessment is completed, typically you may require a follow-up within the first couple weeks after your assessment to check in, to see how you're doing with your program, to see if there's any way we can progress your program, check in to see how you're feeling with your symptoms, and of course address any issues or concerns that have come up between your assessment and your treatment. I sometimes also get the question about what to expect as far as progress if you start with virtual care and continue with follow-ups with virtual care. And my response to that is really that it really shouldn't make all that much of a difference. The expectation should be that there is still some gradual, positive, progressive changes to the symptoms that you're experiencing, as well as how you generally feel. So it's always about working towards your specific goals. So those are pretty much all of the points that I wanted to cover with you today. If you do have any other questions about virtual online physiotherapy or tele-rehabilitation, please feel free to leave a comment below. I'd be more than happy to touch base with you and answer any other questions or concerns that you may have. Okay, take care.